I'm going to be doing a vascular assessment of the upper extremity. So first, I'm just looking for trophic changes of the arms bilaterally, looking at the anterior surfaces and posterior surfaces, and then I would be feeling for temperature of the skin, just noting any excessive coldness or warmth. Then I'm going to assess the nail beds, checking for capillary refill. So I'll do this on one fingernail on each side. And I'm just checking for the return of blood after I let go, and it should return within 2 seconds. Failure for that would be inadequate blood flow, and returns within 2 seconds. Next, I'm going to tent the skin, just looking for skin turgor. If the skin stays tented, that could be a sign of dehydration. And then I'm going to check the radial pulse on the lateral side, on the radial side of the wrist. And I'm going to compare it to the opposite side. And then I'm going to check the ulnar pulse on the medial side of the wrist, and I will compare both sides. And then I'm going to check the brachial pulse, just medial to the biceps tendon. And I'm going to compare that on each side. And then I'm going to check for lymph nodes. So the first lymph node I'm checking for is between the biceps and triceps muscle. So I'm going to flex the patient's arm, and I'm palpating just proximal to the medial epicondyle. And I'm going to check for the axillary lymph nodes. So first I'm going to check for the anterior lymph node, and then the lateral axillary lymph node, and then deep in the axilla, palpating the medial axillary lymph node, and then just beneath the scapula, I'm going to palpate the posterior lymph node, and then I'll do the same thing on the opposite side, checking for the lymph node between the triceps muscle and biceps muscle, proximal to the medial epicondyle, and then I'll check the anterior axillary lymph node, the medial and axillary lymph node, and the lateral axillary lymph node, and the posterior axillary lymph node. And then I'm going to do Allen's test also. So I'm going to have the patient flex their arm and open and close their hand really for a few times, and then I'm going to have the patient clench their fist. I'm going to occlude both sides of their wrist, including the radial and ulnar artery, and I'll have the patient open up their fist, and I'm going to release pressure on the ulnar side, checking for blood return. I'm going to have the patient clench their fist again, occlude both sides, and help the patient open up their hand, and I will release pressure from the radial side, and blood should return to the hand. And I'll do the same thing on the opposite side. I'll have the patient clench their fist, and then I'm going to occlude the radial and ulnar arteries. I'm going to have the patient open up their hand again. I'm going to release pressure from the radial artery, and blood should return to the hand. I'm going to have the patient clench their fist again. I'm going to release pressure from both arteries, have the patient clench their fist again, and then I'm going to occlude both the ulnar and radial arteries, and then I will have the patient open up their hand again, and I'll release pressure from the ulnar side, and blood should return to normal.